Treasure Valley hospitals warn many people have to wait longer to get medical care because of an increased burden on the healthcare system.
The increasing wave of COVID-19 infections has sent some to the hospital and increased the strain on staff, but hospital leaders believe several other factors are playing a role in these delays. Tristan Lewis joins us with what people can expect when they show up to local hospitals. Tristan?
While COVID-19 positivity rates continue to increase around the Treasure Valley, healthcare leaders say those hospitalized with the disease aren't making up a big portion of their numbers. Things like population increase and those who put off seeking medical care throughout the pandemic are now creating a burden on our healthcare system. The number of patients hospitalized with COVID-19 at St. Luke's has grown in the last month.
It's enough that it does have some impact on our capacity.
The health system's dashboard shows 36 patients are hospitalized with COVID throughout St. Luke's, and just 2 of St. Luke's 36 ICU patients have COVID. Frank Johnson, St. Luke's chief medical officer, says that's a small portion of their nearly 550 patients admitted to St. Luke's.
In spite of the fact it's much lower than where it's been in the past year.
Johnson says their patients come in for a variety of medical emergencies, surgeries, heart attacks, mental health issues, substance abuse issues, and more.
There's lots of patients needing care. We're at higher volumes of patients needing care right now for this time of year than is typical by quite a bit.
An increased need during the summer months is pretty typical for St. Alphonsus.
This is a busy time for trauma when people are out and about and that type of thing.
Executive Medical Director Patrice Burgess says St. Al's is taking care of more COVID patients in the hospital as well.
The variant of COVID is very, very contagious.
But it's also not the main culprit, impacting levels of service.
I think we're noticing a little bit is we did have a stretch where people were delaying care because of, the stay-at-home order. Some people were afraid to come in. Sometimes the services were not as available for a period of time.
Both health systems say growth in the Treasure Valley plays a big part overall.
We've got more people moving here, more people living here.
And just like many other industries, staffing shortages can cripple hospitals. Plus, staff still come down with COVID too.
They're not in the hospital, but they also can't come to work. So we're having a few more workers out because it's very contagious right now.
Because they're unsure of what the future holds, both Johnson and Burgess ask for people's patience when they become a patient and need any medical care.
We're all working hard and doing the best we can.
Grant one another a bit of grace as we work together to help all of our patients, our communities get the care that they need.
And while you may be delayed in getting care, local health systems still highly encourage everyone to get the treatment they need when they need it. And although COVID-19 isn't the reason behind most of their hospitalizations, leaders still say they're going to be watching those numbers just because any big spike can create a big impact on those smaller size staff. Morgan and Brian.
Well, Tristan, as you mentioned, this population boom here, it's just kind of one of those other elements of we're not quite ready for it with the infrastructure.
Right. Exactly.
Roads, schools, houses, now hospitals. And again, it's not so much the actual space inside.
Space, yeah.
But the staff.
The people.
To care for those people inside.
You need people. That's right. All right, Tristan Lewis reporting live for us. Tristan, thank you.